So, Arthur, since we saw you last, you warned us it was coming last Friday, the big cut of $5 billion in the food stamp program. Like, so what? Has anything happened?
The cut took effect as expected. Now, it didn't get a ton of play in national media. You know, it wasn't on the front page of your big newspaper.
I've said it before. The only show that I've seen talk about food stamps at all or heard is this one, thanks to you.
I have always had a Google alert, so anytime a blog or news website somewhere in the world mentions food stamps, I get an email. And for the past week, even though there has been no major national attention paid to this, my Google alert for food stamps has just been blowing up because all across the country, local TV stations and newspapers have been diligently covering this. I counted up 100 stories in just 4 days of last week, and the stories are often very similar. They have the local food bank saying, oh no, this is going to be a problem for us, and they have people on food stamps saying, I'm out of this benefit by the end of the month, every month. If you're taking $10, $20, $30 from me, that's just going to give me that much less food. So it's something that is actually reverberating across the country, even though it is being relatively ignored here in Washington.
At the national level.
At the national level.
So I'm glad to hear that the local media is
it's pretty
covering.
Impressive. Yeah.
And so these are real cuts that are hurting real people and causing real pain, right?
It's a $5 billion cut for this 1 year. That's actually 25% bigger cut than even Republicans have proposed in their most extreme legislation.
And it happened because there was this extra money put in as part of the stimulus, which ran out.
Right. So we're reverting to where benefits would have been had that boost never been.
What's it mean for an average family or person on food stamps?
A family of four getting the maximum benefit, which is hundreds of dollars, will have $36 less each month. And that's basically a whole basket of groceries.
I was just because $36 is several meals, right?
Yeah.
That they just have to cut back or put more water in the soup or I don't know. Whatever.
Yeah, that's the kind of thing. Or, rely on family and friends and neighbors a little bit more. Have a little bit less freedom to take care of themselves.
On another front, looking at the economic impact on some families, what have you found out about people who on health? Talking about healthcare, right?
Yeah.
People who, as the president's been talking about, people who have a healthcare plan and yet are going to lose their healthcare plan under the Affordable Care Act. In fact, let me play the president. He said he said while selling Obamacare, right? If you got a plan and you like it, you can keep it.
He said that? That's preposterous.
He said it over and over and over, as we know. Last night, speaking to the Organizing for America, he changed it just a little bit to reflect reality. Here's the president.
Now, if you have or had one of these plans before the Affordable Care Act came into law, and you really liked that plan, what we said was you could keep it if it hasn't changed since the law's passed.
That's a little bit that he added there, right?
If Obama likes his talking point, he can keep it.
Yeah, right. Or he can change it.
Or he can keep it but change it slightly.
Yeah, exactly. What's the reality here? Are people people who have never had health care before, right, are going to be able to buy it under the Affordable Care Act?
Well, the reality is far fewer people are affected by this than almost anything else. The food stamp cut, for instance, 50 million people. This, several million people. So far fewer are being affected by this, and far more will be able to get health insurance, at least theoretically, according to the law. But I can't imagine something more aggravating as someone who has been on the private health insurance market than having been told over and over this law would be good for me, and at the very least it wouldn't bother me. And then to get your insurance canceled?
Yeah.
What's more aggravating than mail from your insurance company? That isn't good news. So it's for real. People are facing serious disruption. Now, the debate is, well, you're only having it disrupted if it changed, like he was just saying.
Or if it's no good. I mean, because
Right.
as the New York Times pointed out in an editorial yesterday, some of these plans had deductibles as high as $10,000 or $25,000, didn't cover hospital care. So they were plans that people may have liked them, but they didn't meet the test of the Affordable Care Act.
That's true. You still could have kept some of those according to the law if they hadn't changed in some way after 2010. For instance, they didn't jack your premium by more than a certain amount. So yeah, the reality is these laws were bad, but if you didn't have an ongoing health problem or suffer a catastrophic injury or illness in that time, you have no idea that your insurance policy is bad. And to just hear it from bureaucrats and politicians is not very soothing at all. So I would have a lot of sympathy for people who are having their lives disrupted by the law. Even if they do wind up in something better that's more expensive, you're not going to know it if you hadn't already been using it. So it's a terrible political miscalculation by the president. Bad broken policy promise too.
Yeah, I mean, in the end, I think people come out ahead. Plus, but I'm not disagreeing with you. I'm just saying, in the end, I think people will come out ahead. And in addition, they have the benefit today of the availability of a subsidy, federal subsidy, which they did not have before. So if they have to get into a new plan, chances are they could qualify for a federal subsidy, and that which is really going to reduce the cost of the new plan.
But even if you drill down into the individual cases being reported and picked over by different websites and journalists, even if you wind up in a better plan, and then you do have an injury or illness, and the plan works pretty well, and you're taken care of, you didn't know you weren't in a good plan before. Even the people who are complaining about having their plans disrupted, you have to have it broken down for you why you weren't supposed to have liked your previous plan.
I know, but let me tell you something. You know what? That's what insurance is all about. I've been paying fire coverage, right, for my house.
Yeah.
For dozens of years, right? Never had a fire at a house.
You haven't burned down your house?
Thank God, right?
Come close.
But, I'm smart enough to know I still need that insurance.
Yeah.
Even if I hadn't had a fire. You still need health insurance, even if you haven't had a catastrophic illness. I mean, that's what insurance is all about.
You just got to guffaw at the notion that people ever loved their insurance, though.
Nobody.
Come on.